Hello, Bell's Palsy here. I hope your day is going well. It's a nice and sunny day here in Seattle. Just back from a dental appointment, and today I'd like to talk about listening to your guts when it comes to treatment and treating yourself for Bell's Palsy. I meet a lot of people and patients that have done the regular routine of going to a doctor and hopefully getting diagnosed early and put on steroids and antivirals. But then are sadly and also commonly told to wait a good 6 weeks before rechecking and see if things are improving. So if you have just been diagnosed with Bell's palsy, and even if it's been quite a while and you are struggling to see changes, my inkling and recommendation on this is to always follow your gut. Yes, Bell's palsy, facial paralysis is very slow to improve, but yet you should still see some improvement. So for example, if acutely you have headaches and discomfort in your ear, some like deep earache, this is generally with regular Bell's palsy is generally pretty mild and should go away pretty quickly. Generally, also the third day of your symptoms is generally the worst, and that is something to remember. But if you really feel like, and especially my cutoff date is 3 weeks. If you feel like it's been 3 weeks, you finished probably at this point your round of meds, and you feel like there's absolutely no change, please do not sit at home. Go see your physician. If you feel like you're not listened to by that physician, just go see another one. And I would insist on them helping you. Either maybe you need a second round of meds. That's actually fairly often the case, and that doesn't happen often enough. As well as hopefully you found me here, but finding a facial specialist that can help you, teach you, demonstrate, and also work on your face regarding massage, stretching, and later down the road when movement is coming back, and not until then, show you how to do some neuromuscular reeducation and working on your face in a slow and controlled manner, and in order to prevent synkinesis. So that's my advice for today. Follow your guts. It is so important. I think if you feel like something's going on, especially if you have much severe symptoms, really like unrelenting pain in your ear, also make sure to inspect inside your ear, inside your mouth, neck, scalp, anything, as it could have been a misdiagnosed. You could have a Ramsay Hunt. You could also have a zoster sine. If you've been in the woods recently and have noticed a bite, an insect bite, you need to make sure to be checked for Lyme disease as well. But once again, don't sit around. Sitting around for anything medical, and particularly neurological, has never really been successful, I think, for anyone. So just be proactive. Don't sit around. Yes, once again, there is a factor of waiting and letting things heal organically with Bell's palsy. But if you've been on meds, and if it's really just Bell's palsy, if you're on meds, the worst symptoms should really improve within the first 3 weeks. Same thing if you feel like your eye is so dry, you have to use drops throughout the day, And no matter how much you do of that, how much taping you're doing at night, how much maybe you're using a vacuum chamber to put on your eye, using some ointment at night, and no matter if you're doing all this and your eye continues to bother you, it's getting red, please as well go see an ophthalmologist. If you have also seen just an ER doctor, urgent care doctor, or your GP, and you think that you either, if it's an ER doctor, you're generally not going to see that person ever again. And if it is your GP and you don't feel listened to, go see another one. See maybe preferably a facial nerve specialist, like an otolaryngologist, or most commonly known as an ENT. But get on it. Listen to your gut. Listen to your gut. Listen to your gut. Have a great Tuesday, and I will catch you later.